One of the most difficult patients I had in acute care was an 80-some-year-old female who lived alone in a house with many stairs to get in. And she admitted to the hospital after she was recently diagnosed with Parkinson's, and that led to the discovery of a metastatic lesion to her L2 vertebrae. So she came here and she was being worked up for the cancer and deciding what treatments they would undergo. PT was consulted for some of her deficits related to Parkinson's, and when I first met her, it was very clear that this was going to be a complex patient for several reasons. One, she lived alone, so that presented barriers for discharge and her safe ability to go home independently again. Secondly, the patient had a lot of underlying cognitive deficits that I think were exposed in the hospital, one of which being she had distrust in all of her relationships within the healthcare. So she didn't believe that there was actually cancer in her spine. She didn't believe that everyone here was going to help her. She had believed that the images showing her met were fabricated and that there wasn't anything in there. And then she also distrusted her family, and she thought that they were lying to her, and she was angry that they had admitted her into the hospital. So when I went to work with her, I tried to teach her log rolling first of all, and she wouldn't adhere to this because she didn't believe anything was wrong. So we had direct risk to her spine and injuring the affected lesion with that concern. And then she also didn't believe she was a fall risk, which she had fell several times before coming in here. So she was a little bit resistant to using gait aids and listening to some of the advice I had with that. So with this patient, I ended up, first of all, recommending she discharge to a skilled nursing facility. And then secondly, I talked to her medical team and conveyed my concerns about her capacity for decision making, which was especially important with this patient because she was deciding which chemotherapy regimens to go on and kind of making some very big decisions that needed a clear head. And I ultimately ended up supporting this in my documentation by using some of her direct quotes about not believing in her lesion and her cancer, and then contacting the service and just really letting them know what I was seeing from a therapy standpoint. So at the end of this all, the service kind of took me seriously, talked to the patient and her family about changing who was in charge of decision making, and then she ended up discharging to a skilled nursing facility.